So now it is about the urinary bladder. The urinary bladder is a distensible muscular bag. It is a distensible muscular bag, or urinary bladder is acting as a reservoir of urine. It is using for the collection of urine. It is a distensible muscular bag. The wall is like the ureter. The wall of the bladder is also made up of three layers and lines with the urothelium. That is same like the ureter. The innermost mucosa is made up of urothelium or the transitional epithelium. The lamina propria with the connective tissue and blood vessels. The middle layer is the muscular cord, which is formed with the bundles of smooth muscle, and the fibers are arranged in all directions in a complex meshwork like arrangement. So this is the layer. This is the diagram how we can draw. That is the towards the lumen or the cavity, the innermost layer is the mucosa. The mucosa is lined with transitional epithelium or the urothelium, and below the transitional epithelium or external to transitional epithelium, being it is the lumen. അപ്പോൾ ഇത് wall-ആണ്. That wall innermost ആയിട്ട് കാണുന്ന transitional epithelium. Outer to that we can see the lamina propria or the transitional epithelium is resting over a lamina propria, again which is made up of the connective tissue, and external to this layer there is the muscular cord. The speciality of the muscular cord is that it have got inner and outer longitudinal layer. We can say this is a longitudinal section of smooth muscle bundle. We can see in a rounded manner. The cut sections can be seen like bundles. So inner longitudinal and outer longitudinal layer with intermediate or the central circular layer. So the three layers, not like ureter. Ureter have got two layers of smooth muscle. Here the urinary bladder have got three layers of smooth muscles: inner longitudinal, outer longitudinal, and intermediate or the central circular fibers, circularly running smooth muscle bundle. It constitute the middle layer, and like that external most layer is the serous layer or the adventitia. That adventitia again contains the like the ureter. It contains adipose tissue, areolar tissue, areolar tissue, and there is the presence of blood vessels, nerve endings, lymphatics, all the things which are separating the organ from the external connective tissue. So this is the diagram how it appears under the microscope. This is the transitional epithelium, the lining epithelium, which is also folded because it is a distensible organ, isn't it? So that this epithelium is a wear and tear epithelium, and it have got a distensible capacity or expandable capacity, so that the mucosa which is present over the lamina propria is folded on itself, because in a distensed or in a filled nature, in a filled state only, this mucosa will be in a straight manner. So that here in this diagram, it shows the transitional epithelium innermost the mucosa forming the transitional epithelium and the lamina propria. Then comes the muscular layer with inner longitudinal and outer longitudinal fibers with intermediate circular fibers, and outermost there is the presence of adventitia. It is not showing in this diagram, but there is the adventitia. So here we will study about the features. It is distensible muscular bag. Wall of the bladder is made up of three layers. Innermost mucosa made up of urothelium or the transitional epithelium. the lamina propria which connect with the connective tissue and blood vessels. The middle layer is the muscular cord, bundle of smooth muscle. The fibers are arranged in all directions in a complex meshwork-like arrangements. The muscle contains speciality. It has three layers of smooth muscle. Outer and inner longitudinal layers are there with central circular layer. The outermost layer is the adventitia, which is made up of loose connective tissue, blood vessels, lymphatics, nerve fibers, and adipose tissue. So that is all about the histology of urinary system. So in urinary system we will learn about kidney, ureter and urinary bladder. Once again the summary of the kidney. In a cut section of kidney we can see there is a presence of cut sections of tubules, proximal convoluted tubule, distal convoluted tubule, and the Bowman's capsule or the glomerulus can be seen. Then there is in medulla, that is all these three structures can be seen in the cortical region, and in the medulla of the kidney there is a presence of medullary rays, which is the sections of connecting tubules or the collecting ducts. And in case of the ureter have got a star-shaped lumen with a lining epithelium which is named as a mucosa, and this mucosa have got two structures comprising in it, that is the urothelium and the lamina propria. Outer to lamina propria there is a presence of muscular cord, that is the second layer, which contains inner longitudinally running fibers and the outer circularly running smooth muscle bundles. External most layer of the ureter is adventitia, which is formed with the collection of adipose tissue, areolar tissue, lymphatics, the blood vessels supplying the ureter, the nerve endings supplying the ureter, and this is the tissue which separates the ureter from rest, either both. It separates the ureter from rest of the structures and also merges with the connective tissue of the rest of the structure. So that as the ureter. Then urinary bladder. Urinary bladder is also can be divisible into three layers. The innermost layer is the towards the lumen. The innermost layer is the transitional epithelium, which is resting over the lamina propria. Together comprises the mucosa. Outer to that there is muscular cord of the transitional of the urinary bladder. The muscular cord is formed with smooth muscle in three layers, arranged in three layers. They are interlacing muscular bundles, inner longitudinal, outer circular inner longitudinal, outer longitudinal or intermediate circular bundle of smooth muscle can be seen in all directions. The muscles are passing in all directions, and outermost layer is the adventitia or serous layer. That is adventitia have got same like the ureter. There is a presence of both structures present in the ureter itself, that is the connective tissue, the loose areolar tissue, the adipose tissue, fat lobules, adipose tissue, the lymphatics of the urinary bladder, then the blood vessels of the urinary bladder, and the nerve endings of the urinary bladder also can be seen in relation with. So this is all about the histology of urinary system. Thank you.